We are live now.
Okay. Good afternoon, everyone. Myself, Dr. Kanchan Durukar. I am consultant at Oasis Fertility, Wakad, Pune. I welcome you all for the Facebook live session. And today our topic is about IUI. And today we are going to discuss about what we can do to improve the success of IUI cycles. So basically, first we will talk about what is IUI. So full form of IUI is basically intrauterine insemination. So what is this intrauterine insemination? So basically it is the insemination, that is insertion of a processed semen sample of a husband after the ovulation that is registered in the wife after the ovulation monitoring. We process the semen sample and then we inseminate it in the uterine cavity, that is called intrauterine insemination, that is IUI. So basically I will talk, first of all I will talk about the indications that when the IUI is needed in the patients with infertility. So what are the indications of IUI basically that we will discuss. So there can be some male factors of infertility like anatomic defects in the form of hypospadiasis. Then there can be some sexual dysfunctions, erectile dysfunctions. Then there can be some motility or morphology issues in the sperm in the form of steno or teratozoospermia. Then in females, there can be anovulatory menstrual cycles, like in the cases of PCOS, where the ovulation is delayed or there is anovulation. Then there can be mild to moderate endometriosis, where we can go for IUI cycles. Then sexual dysfunctions in females also, like vaginismus. Here also we can go for IUI cycles. Then unexplained infertility is also one of the prime indications for IUIs. Then IUI donors, IUI with donor sperm. What are the indications for IUI donor sperms? So indications are azoospermia, where we have no sperm counts in the male partner. Then we have genetic disorder in the male partner, or serodiscordancy. So these are the indications for donor sperm insemination, that is donor IUI that we call as. So these are the various indications for which the IUI can be done. Now we will come to our today's this point of discussion, that is how do we improve the success of IUI. So basically I will cover how the IUI cycle is conducted. So at our center we do like day 2 or day 3 scan when the patient have a menstruation. We do the scan at second or third day. Then we give them some oral ovulations and gonadotropins, which we prefer. That is stratified according patients to patients. We stratify the protocols. Then after that, day 8 scan is done. Follicle monitoring on day 8, day 10, and day 12. So according to the growth of follicle, we stratify this cycle and frequency of ovulation monitoring. Then we select the timing, or we come to the timing of IUI. So how the timing of IUI is decided, that is very important to optimize the success of IUI. Like we see for the blood flow of follicles and the vascularity of, or the blood flow and the RI, that is resistance index of the follicle, to judge the timing of IUI. Accordingly, we give the trigger and we see for the timing of rupture. So accordingly, we time the IUI. Generally, for normally we give the trigger, and after 36 hours we go for IUI. That is, we do the rupture scan. If the rupture is documented, then we do the IUI. But we can, if deciding according to the blood flow of the follicle, if the tentative rupture, if the blood flow is more and it is tentatively going to rupture in 24 hours, then we can do the pre-ovulatory IUI also. That is double IUI, that we call pre-ovulatory and ovulatory double IUI, that can help us improve the success of IUI. So not in every patient, but this is stratified upon patients to patients, whether the follicle blood flow is up to mark where we can do the double IUI, or the single IUI is enough for the patients. That has to be stratified. And then we do the sperm preparation. So different type of sperm preparation is done again depending upon the motility and morphology of the semen sample. Basic semenasis is done by the andrologist. At Oasis Fertility, we do it with the specialist andrologist we have who do the semenasis, and accordingly we take the decision of whether how to do the semen sample processing, whether it should be a double density gradient processing, whether it should be a swim up, or whether it should be a swim up, or whether it should be a simple wash. So this is stratified according to the semen count, again motility and the morphology of the semen sample. So basically, we two methods of semen preparation that we use here are double density, that is density gradient, and swim up technique. Now, if the patient is having raised DFI, that is DNA fragmentation index, if the male partner is having raised DFI, that is more than 35%, then we can go for the sperm selection techniques also. That is max is magnetic assorted cell sorting. So this magnetic associated cell sorting can give us better motility and better sperm selected, so that can improve the result of IUI even. So that can also be used. Max can also be used where the DFI is raised in the semen sample. So this is again one of the sperm preparation techniques that we talked about. Then endometrial preparation, that also should be optimal during the IUI cycles. So optimal endometrial preparation more than 7 mm, or blood flow of the endometrium, that also should be checked while follicular monitoring is done for IUI cycles. So this is about the IUI, pre-ovulatory, um, post-ovulatory, and how do we time the IUI, and how it can improve our success rate. Now, I want to come forward with the different protocols that are used for IUI cycles. Now, natural cycle IUI are also done, but ASRM guidelines says that natural cycle IUI are not recommended. At least oral ovulagens, that in the form of clomiphene citrate or letrozole, should be used for IUI cycles. Clomiphene citrate for 5 days, 100 mg for 5 days, or letrozole from second day for 5 days can also be used. These oral ovulagens, along with follicular monitoring and IUI after rupture, can also be followed. Or ovulagens with gonadotropins. Oral ovulagens with gonadotropin, that is clomiphene plus gonadotropins, or letrozole plus gonadotropins, can also be used for IUI cycles. So, controlled ovarian hyperstimulation with IUI is generally preferable for the patients with infertility because it improves the pregnancy rate. Now, how it improves the pregnancy rate? Basically, we in the controlled ovarian hyperstimulation with IUI cycle, we basically stimulate the ovaries so that we get 2 or 3 follicles. So if we get 2 or 3 follicles and ovulation of the 2 or 3 follicles is achieved, then we can have better pregnancy rate as compared to a monofollicular growth. So we with oral ovulagens and gonadotropin, we can achieve 2 to 3 follicles, and ovulation. If there is a superovulation, that is ovulation of 2 or 3 follicles, then the pregnancy rate is definitely higher as compared to only oral ovulagens. So at Oasis Fertility, we generally follow oral ovulagens with gonadotropins as a protocol for IUI to optimize the results of IUI. Now, after ovulation has occurred, we do the IUI. Then after that, ovulation and IUI has occurred. After that, the luteal phase support is very important because the progesterone support after ovulation, for implantation and further carrying of pregnancy, progesterone support is very, very important. That is given in the form of either oral progesterone or vaginal progesterone. And after that, the pregnancy test has to be carried out. Now, I will be talking about IUI failure. Now, why the IUI failure occurs? Now, there can be some unaddressed issues Like there can be some tubal factors. Apart from patency, there can be some tubal factors in the form of damaged tubes, tubal saculations. Then there can be some endometrial infections in the form of endometritis. Then there can be mild to moderate endometriosis also, which is not detected in 2D or 3D scan. That can be diagnosed with diagnostic hysterolaparoscopy. So the patients with 2 or 3 IUI cycle failure, we can advise or they should go ahead with diagnostic hysterolaparoscopy, where we can exactly find out the cause of IUI failure. Then, if the cycle is repeated cycle failure is there, and previously the other causes of infertility have been sorted, then we should actually move ahead or upgrade the treatment in the form of IVF, ICSI. So, if the patient is not able to achieve the pregnancy with IUI cycles, if the repeated IUI cycles have been done, but the couple is not uh, achieving pregnancy with IUI cycle, then we should move ahead with IVF or ICSI that we generally advise at our center also. Now, uh, last but not the least, I want to talk about the myths on IUI cycles. Generally, what the patients ask us, like whether the traveling is should be avoided totally. No, actually, couples can travel after IUI cycle. Then natural contact should be avoided or completely avoided or what? No, actually, natural contact is beneficial because the ovulation has taken place on the day the IUI has been done. So that day the ovulation has occurred. So IUI is basically, after IUI cycle, natural contact is basically beneficial and not should not be avoided. That is what the main concern the couples may have. Then third, I want to tell that complete bed rest is not required after IUI cycles. Many couples ask that whether we need a complete bed rest if the IUI has been done. So no, the IUI, after IUI cycle we don't need to, and it doesn't affect your success rate also. You can do your daily work, or if you're a working lady, you can continue with your work after your IUI has been done also. So this myths I wanted to clear. So I think that's all from my side. If the viewers have any question, they can put that on the comment box. And if at all you have any queries, we have OSS fertility helpline number where you can contact. It is flashing on the screen. Or if at all any physical consultation is required, we have our centers at OSS Fertility Wakad, Pune, and also at Kharadi. Thank you, viewers. Thank you, listeners. Thank you very much. This is Dr. Kanchan Durukar. Thank you all.